Hi everyone, my name is Sydney Dull. Thank you so much for taking the time to consider me for St. Kate's DNP program. I really look forward to telling you a little bit more about myself and what interests me so much about St. Kate's DNP program. A little bit more about me. I'm from Minnesota. I went to school at University of Wisconsin-Milwaukee. I graduated May of 2022, started my nursing career in June of 2022. I was a CNA as my first healthcare experience. I worked at School Sisters of Notre Dame in Milwaukee. Most of the sisters I worked with were 70 and above. After that, I was a nurse extern my final semester of nursing school. I graduated and started my nursing career on a floor that focused on pulmonary hypertension, heart failure, and post-procedures, including ICDs, pacemakers, Watchman's ablations. I loved those. After that, I moved home to Minnesota, and I worked at U of M Fairview East Bank. I worked on 6C. That was a post-TAVR, CABG, heart-lung transplant floor, LVAD. Favorite job I've ever had. I learned so much. I'm very thankful for my time there. It really helped me develop my skills and just overall critical thinking skills as a newer nurse. After that, I moved back to Milwaukee for a little bit. I work in the EP lab here. It's been really cool to see this different side of nursing. It's a lot different than bedside. I've learned a lot of new things. It's really cool to work with also different health professionals on the floor. I was working with a lot of CNAs, PT, OT, nutritionists, and down in the EP lab I'm working with cardiovascular techs and anesthesiologists and physicians. So it's been really nice to see kind of all aspects of the healthcare field and see how kind of all comes together and works as one team for a patient. So a little bit of what motivates me to become a DNP. A few of the biggest ones are just overall professional growth. I really want to be able to have higher critical thinking skills. I want to be able to assess my patients at a higher level. I really look forward to seeing my patients from beginning of diagnosis to recovery. A lot of times on the floor I was seeing them on an acute basis, but I look forward to seeing them over a longer period of time to be able to really tailor the patient's needs to what they want and be a part of that care plan decision making. I really look forward to that. I also look forward to stepping up into a sort of leadership role. I see a lot of NPs now, and I really look up to them. In my job now, I work closely with a lot of electrophysiology nurse practitioners, and they are wonderful. They're a great group of women who are always willing to educate me and answer questions I have, or patients diagnosed with the same thing, but they have two different one patient's care plan is this and another is that, and they're able to explain why we're doing this, which is something that I really want to be able to do as a nurse practitioner. I really want to be able to support my patients and advocate them and be there for them at a little bit of a higher level and provide high quality care to them. A little bit of that leads into what qualities I like so much about St. Kate's mission and vision, which is to educate women to lead and influence. Like I said, I work with a lot of women NPs right now, and they're wonderful to work with. I hope that someday I am able to do that to other, whether it's new grad nurses or other nurse practitioners or other people within the health field. I really hope to make a great impact on other patients and other families and my other coworkers and care team. This is something that I wanted for a really, really long time now. I think I've always known that I was going to end up at graduate school and that this was going to be where my career took me. I'm very dedicated, and I look forward to having this opportunity to pursue higher education. I really want this for myself, but I also want it to for my patients and for the community that I work in, to be able to care for them and really provide exceptional care to them and be able to be that healthcare professional that they can rely on and trust and know that I have their best interests out for them, and I'm going to do everything in my power to make sure that their needs are heard and that it's a safe care plan, and to be able to be that figure for them. So a little bit about my previous leadership roles. My first job I worked on, it was a little bit short-staffed, so there were a lot of times that I would be willing to stay extra hours to make sure that nurses weren't going with unsafe patient ratios. There was a few times I remember pulling 16-hour shifts. I would pick up shifts to help out the floor. I felt like shift change was a huge time where things got a little crazy because a lot of people were coming and going, and I feel like I knew that, and I would step up and make sure that I was able to help out other nurses if something was going down during that time. I also felt like I was just a resource to other nurses in general. While I was there, I was always willing to help out and do what I can to help my coworkers. As for outside of my professional job, I swam for probably the past 15 years. I was a Division I athlete in college. I was captain my senior year, hardest working my freshman year, and most improved my junior year, voted by the team for all those. I am a very hard worker. I'm very dedicated. Whatever I set my mind to, I really, really want to accomplish, and it's something I'm very passionate about. I credit a lot of who I am today from swimming. You know, it taught me a lot. It taught me how to work in a team, how to be disciplined, how to manage my time correctly, how to, it's okay that you don't do as well as you want, as long as you're willing to, continue to work hard and thrive, and trying to, whether it comes to school, educate yourself, or swim, to, work harder and not let that defeat you. I credit a lot to that, to swimming, which is how I look forward to being successful in grad school and nursing school. Time management was a very big thing. The planner was my best friend. I had everything planned out. I really valued school time, but also personal time. So I look forward to being able to balance both with time management. I was also very lucky. I had a great cohort, a great support system around me, which I believe will help me be successful in grad school. And then flashcards were my best friend. But I'm running out of time here too, but I just want to say thank you so much for considering me for St. Kate's DNP program. I really look forward to hearing back from you guys and for this opportunity. Thank you so much.